Hello everyone, thanks for joining me again today. So I felt compelled to put a video together today about chemotherapy and your teeth. I know it's not a great pleasant subject, but I felt like I needed to maybe put something together, maybe my experience and some tips, so that if you ever find yourself going through chemotherapy, you can have a point of reference or something to look back on. So let's get started. First of all, it's very sunny today and I can barely see, so I'm going to put my glasses on. All right, so chemotherapy in your teeth. So one of the side effects of chemotherapy is dry mouth, and we're talking serious dry mouth. Chemo drugs destroy all good and bad cells in the body, and they affect the salivary glands in your mouth. And what basically happens is you end up with this severe, horrible dry mouth. And sometimes, for some people, including myself, I was in this constant state of my mouth feeling and tasting like I was sucking on metal. And it was just awful. But also what happened is it really damages or can damage your teeth. And in my situation, I was already aware that this could happen because I was told it could and because I read it might. Your gums become very sensitive, your teeth become very sensitive, your teeth can start bleeding. Some people actually lose teeth just fall out of their mouth. You could unfortunately experience tooth decay, especially the longer you're on chemo drugs. I only had to do 4 rounds every 21 days last year. This year I'm going to be doing 8 rounds every other week. So this is a really hot topic for me and something that I want to be on top of. So very first thing I recommend is calling your dentist and or finding a dentist, if you don't have one, who is familiar with or has treated in the past or currently people that have undergone chemo treatment. Because what I'm going to recommend is, along with your 2 cleanings per year that everyone should be getting, especially if you have dental coverage, is an additional cleaning, but not a deep cleaning or like a regular cleaning that you normally would get. That's why it's important you find a dentist that is experienced treating people with chemo. It's going to be a very light cleaning. And the reason for this is because when your mouth dries up, you don't have that saliva that most people get in their mouth. When you're eating acidic foods such as fruits, maybe certain vegetables, etc., that acid is clinging to your teeth. It's not getting wiped away, and it can break down the enamel and cause all kind of other things to happen to you, especially if you're not taking in regular fluids, gargling, or anything like that. Wow, there's like 3 dragonflies right in front of my face. 4 dragonflies. What? I've never seen this before. Anyhow, back to the subject. So your teeth can get completely damaged because they're vulnerable, and so you want a dentist that knows what they're doing. And so if you don't have a dentist, of course, call your dental insurance and get a list. Google, go to Yelp, whatever you need to do, and start interviewing dentists. I mean, there's no shortage of dentists everywhere, especially where I'm from, where I currently live. There's dentists in almost every strip mall where there's any type of medical offices. There's usually 2, 3, 4 dentists lurking around. So there are dentists everywhere. My dentist happens to work with and has worked with patients that have been on chemo, so he is thoroughly knowledgeable of what is needed. So when I was going through chemo, I called my dentist and said, hey, this is what's going on. I'm going to need that extra care. How much would you charge for that? Because unless you have a note from your oncologist and your dentist to back it up, most insurance won't cover it. But your medical insurance might, and you definitely want to try that. I didn't try that last year. I could have. My dentist was definitely willing to go to bat for me, But the fee my dentist was charging was about $110 to clean my teeth for cleaning. And you can find cleanings anywhere from $75 up to several hundreds of dollars. So anyhow, if you're not able to see a dentist, a couple things that were recommended for me that I would definitely recommend to you that may help. The first thing is something called biotin. So when I was going through cancer treatment last year, and I was mentioning things on Facebook, I had several women reach out to me. One was a nurse from California, a friend of mine, and the other one were ladies that were following me, great women on Facebook that actually have gone through treatment themselves. Highly recommended this product. This is the mouth spray, and this is good because a lot of people going through chemo treatment, the drugs do cause sores, especially in the back of your throat, on your gums. I mean, and some of them are horrible, and this is a good spray to help get through that pain, kind of helps numb the pain. But the biotin mouthwash, it became my best friend, folks. I used it all the time. And if you don't do the biotin mouthwash, warm water and salt gargles are real popular too. In fact, that's what the doctor recommended. But biotin was a lifesaver. You can get it at any drugstore. I got it at Walgreens. Another thing, if you don't have a dentist, or you do have a dentist and you can't afford the extra cleanings, have them prescribe a toothpaste for you, folks. I got this directly from my dentist. It costs about 15 bucks, and some insurances might actually cover this. This is a Clean Pro 5000. Basically, it has an extra layer of fluoride. And so basically what you do is you brush your teeth for 2 solid minutes and you don't rinse. You might spit out anything that's extra in your mouth. But remember, you're not really producing saliva, or it's very diminished. So you're probably not going to have anything to spit out, and that's okay. That's normal. Don't freak out about that. But you don't really want to rinse it. You want to brush for 2 solid minutes. Not less than 2 solid minutes. Really brush those teeth. Get in there, get those gums, and then just spit out any excess. This is prescribed fluoride toothpaste, and this is going to help a lot. Also, one last thing that I'm going to recommend is that you stay on top of your fluids. This is so critical. It's critical in life just in general, but specifically during this period of time. Fluids. This is water, so I highly, of course, recommend water. Keep it on your nightstand, in your living room, your dining room, kitchen, on your desk at work if you're even able to work. Keep it in your purse, your car, men and women, because chemo, again, those drugs that you are using, they are so toxic, and there's so many side effects. And I'm just talking about one side effect today, which is your teeth, your mouth. And again, just to recap, it's going to be important to find a dentist that is familiar with patients that have gone through chemo and how to treat that, give you that extra care. I'd highly recommend a fluoride prescribed toothpaste. They cost about $15. Warm water and salt rinses, you can create those at home. YouTube it, Google it, and how to do it. And if that doesn't work for you, biotin is a great product. They have a great rinse. I use it all the time. The mouth spray is also highly recommended because chemo does create the sores in the mouth, especially the longer duration of chemo you have to do. And finally, fluids. Key, because your saliva is totally, you're not producing it, or you're producing very, very little. And so saliva production is key in protecting your teeth, a component. A lot of people don't think about that, but it is key. And when you're no longer producing saliva, your teeth are at risk. So these are just tips that I want to share with you, something I want to bring to you today in this video. And I hope this helps somebody, if not you, maybe someone close to you. Maybe you can share this information, refer them back to the video one day, who knows, whatever. But that's my tip for the day, everyone. And I hope you have a great day, great week, enjoy the weather. It's beautiful here in the Pacific Northwest. And until I see you again, And I have a little one here that just really wants to be in the video. You just really want to be in the video, don't you? Come here and give me some love. Give Mama some love. Just love him. He is the best. And she wants to be in the video too. Give me some love. Give him Mama some love. Okay. Have a great day, everyone. Until I see you again. Bye-bye.